Okay. And so in the interest of time, we're going to go on and get started. So good evening and thank everyone for joining us for another installment of our Ask the Doc series. I'm Titania Bailey, president of Arc of Knowledge, Inc. We are a nonprofit organization that provides resources towards building and strengthening relationships between our generations. And as a part of our generational health and well-being initiative, we have the pleasure of partnering with MedStar Health and their team of specialists to provide education and resources that promote better health practices. Today's presentation will feature two presenters, Kathy Gibson and Sparkle Lopez. Kathy Gibson has been a perinatal nurse for over 30 years and has spent her career caring for women in the prenatal and postpartum settings. She is currently a mother-baby nurse at MedStar Southern Maryland Hospital and has also worked as a lactation consultant, perinatal safety nurse, and in labor and delivery and antenatal testing. In addition to being a nationally certified nurse, Kathy is an internationally certified lactation consultant. She is passionate about patient education and quality nursing care and was recently recognized with the MedStar Health Nursing Impact Award. Kathy is active in the Maryland Nurses Association, her church, and her community. She hopes to see lactation support more accessible to patients after going home from the hospital, improving breastfeeding success, and the ultimate health of our community. Our other presenter is Sparkle Lopez. She is the coordinator of lactation services and childbirth education at MedStar Southern Maryland Hospital. She earned her bachelor's degree in nursing from Towson University. After struggling through her first breastfeeding journey, she felt moved to support other mothers to breastfeed. In the 20 years that she worked as a level 2 NICU nurse, she provided education and hands-on assistance to her breastfeeding patients. Wanting to be able to do more for her patients, she became an international board-certified lactation consultant in 1999, completing her master's degree in health education and promotion in 2016. She then used those skills to lead the hospital and earning the prestigious baby-friendly designation in 2023. Sparkle is a lifelong resident of PG County, where she's raised her 4 children. She's dedicated to making a difference in the health of this community through the benefits of breastfeeding. Please welcome Kathy Gibson and Sparkle Lopez.
Well, thank you, Ms. Bailey, for that introduction. And thank you all for sharing this time with Kathy and myself. We are grateful for this opportunity to talk about our favorite topic, which is breastfeeding. So, Kathy, if you could start the PowerPoint.
Speaking of technical difficulties, I've been practicing this, and then of course, let's see, it's not that hard, but give me just a second here. Share screen. I got to bring it back up on the screen. There we go. All right.
All right, thank you. So most people know that breastfeeding is best for babies. It offers them the perfect mix of nutrients, includes immune boosters, protects them from a lot of the nasty germs, viruses, and bacteria in the environment, and greatly reduces the risk of them developing some chronic diseases later in life. What a lot of people don't know is that breastfeeding also heals mom after delivery, cuts down on the amount of blood loss she'll have, and can positively affect her health for the rest of her life. For those reasons, the American Academy of Pediatrics states that breastfeeding or breast milk feeding, so pumping milk to give to the baby, is actually a public health imperative. Every pregnant woman should be educated about breastfeeding so that she can make an informed decision about how she chooses to feed her baby, not only the benefits of breastfeeding, but the risks of formula feeding. For moms with certain medical conditions, it is essential that they commit to breastfeeding. So that's what we're going to talk about for these next few minutes. Women with hypertension, either chronic or gestational, and those with gestational hypertension or diabetes. And gestational just means that the condition starts during her pregnancy. So here we go with breastfeeding for your health, hypertension, and diabetes. Next slide, please. So first I have to recognize Dr. Sonia Semenik. She is an associate professor and nurse researcher. That's her information there. She presented a webinar called Breastfeeding for Maternal Cardiovascular Health, a review of the evidence at a breastfeeding conference that I was able to attend. For the entire hour, I was hanging on her every word. It was actually emotionally moving experience for me, and it led me to focus on changing the conversations around breastfeeding benefits for infants, which many people already know about, to the important health benefits for mom. All of the scholarly information and most of the statistics in this presentation are from her lecture. Next slide, please. So here are a few statistics that you may find troubling. Cardiovascular disease, which I will shorten to CVD going forward, is the leading cause of death for women. CVD is a group of disorders of the heart and blood vessels and includes coronary heart disease, where the blood vessels can't bring enough oxygenated blood to the heart, and cerebrovascular disease, which affects the blood flow to your brain. Stroke is the fourth leading cause of death for women 65 and older. CVD in Prince George's County is higher than the state average. And this is also the leading risk factor for heart disease in women, high blood pressure. Next slide, please. So now to talk about some troubling statistics in pregnant women. Half of all women who develop gestational diabetes during pregnancy will go on to develop type 2 diabetes in their lifetime. Having gestational diabetes increases the risk of CVD by 68%. So according to the PG County Health Report, gestational hypertension affects 5 to 10% of the pregnancies in Prince George's County, and gestational diabetes affects about 10%. So Kathy and I have been a team for a really long time, and she actually pushes me to be a better person all the time. And so last night she texted me to say, hey, I was reviewing the PowerPoint and those numbers look really, really low to me. So today I had to go back and look over our data here at the hospital. And although gestational diabetes numbers at MedStar Southern Maryland Hospital are similar to the counties at about 10%, in the past 3 months of the women who delivered at our facility, a full 25% had hypertension that affected their pregnancy, their delivery, or their recovery. So our statistics here are actually much darker than those for the rest of the county. Next slide, please. So this is important because those who have gestational diabetes or gestational hypertension have a 4 times greater risk of developing chronic hypertension. And remember, I said hypertension is one of the leading causes of CVD. And they also have 2 times greater risk of having CVD 10 to 15 years after delivery. So think about these moms who have a 10-year-old at home and are maybe, having issues with their heart, or they're having strokes. So this is really important that we, again, change the conversation here about the importance of breastfeeding for mothers. Next slide, please. All right, so what's going on here? So I want to start this slide by acknowledging that women's bodies are amazing. And when a woman becomes pregnant, her normal body functions, especially the way her heart works, so her cardiac functions, and her metabolic functions, which are the reactions that allow us to change food into energy, are altered to support mom while she's growing a tiny human, which I think should be considered a superpower. Next slide. So some of the things that occur beside that growing baby bump is that total cholesterol and triglycerides, which is a type of fat found in your blood, and insulin all naturally increase during pregnancy. These changes of pregnancy are exaggerated in those with obesity. Women develop visceral fat, so the baby weight that they put on when they're pregnant. Those who never breastfeed or breastfeed less than 3 months can carry that visceral fat until menopause, when it becomes much more difficult to lose. It's important to note that visceral fat is more strongly associated with cardiac and metabolic risk factors. So we're going to revisit that in a couple slides. Next slide. All right, so now we get to talk about oxytocin. It's also known as the love hormone. Oxytocin is so important. It acts as a chemical messenger in our brain, has an important role in many human behaviors and social interactions, which include sexual arousal, trust, romantic attachment, and parent-infant bonding. So another function of oxytocin is to stimulate uterine contractions when mom's in labor. Once your baby's born, oxytocin promotes breastfeeding by causing contractions of the milk-producing cells in the breast, and this moves milk through the breast and down to the baby. But here is the proof that our species was designed to breastfeed. There are also oxytocin receptors in the heart, in the kidneys, and in the veins. So working with these body organs, oxytocin improves how the heart functions. It decreases cell death and inflammatory responses. It decreases blood pressure, which leads to decreased heart rate and decreased level of the stress hormone called cortisol. Next slide, please. So when mom chooses to breastfeed, oxytocin protects against CVD by resetting mom's body back to normal after the changes that occurred in pregnancy. When a mom chooses not to breastfeed or pump for her baby, she does not get that reset. And breastfeeding alters mom's body, so maternal glucose and carbohydrates are mobilized and used for milk production instead of becoming additional fat. So remember, I said earlier that visceral fat is more strongly associated with cardiac and metabolic risk factors. Well, guess what? Breast milk production burns additional fat stores and decreases mom's visceral fat. So it is definitely helping her to become more healthy. Next slide, please. So you don't have to trust me on this because I'm a lactation consultant. And of course, I think everyone should breastfeed. But there are actual results from studies to back this up. And again, Dr. Semenik is where I got all of this information. One study showed that ever breastfeeding showed an 11% decreased risk of CVD, 14% reduced risk of coronary heart disease, 17% reduced risk of fatal CVD, and this was stronger among those who breastfed longer. Breastfeeding at all reduces the future risk of diabetes by 27%, especially among those with gestational diabetes. That's that reset that we've been talking about. Breastfeeding for more than 4 months reduces the risk of CVD among obese women by 20 to 30%. Breastfeeding for more than 12 months decreases risk for diabetes by 30% and reduces the risk of hypertension by 13%. And remember, the leading risk factor for CVD in women is hypertension. The protective effect of lactation on CVD risk is strongest for hypertension and can continue to protect a mom for decades. So a large US study showed that compared with those that never breastfed, any breastfeeding reduced the stroke risk by 23%. This association was strongest in African American women and reduced their stroke risk by almost 50%. Next slide, please. So what can we do? If we really want to invest in the health of generations to come, we have to get the whole community on board. We need more moms to breastfeed, and we need to help moms succeed. Like a lot of things in life that are worthwhile, breastfeeding can be difficult. So what can we do? Well, number one, we can encourage breastfeeding. First and foremost, educate yourself about breastfeeding. And that's what you're doing right now. So thank you for being here. If you know someone who's expecting, talk to them about breastfeeding. Tell them that it's healthier for her and her baby. Help her find statistics. If you know a mom who has hypertension, gestational hypertension, or gestational diabetes, encourage them to take a prenatal breastfeeding class. Our prenatal breastfeeding class here at MedStar Southern Maryland is free for moms who will be delivering here, but MedStar does have classes at many of their other facilities. You can have mom contact a local lactation consultant. If she's eligible for WIC, encourage her to talk to a breastfeeding specialist there. It might seem kind of dramatic to say, but as this research shows, you may be saving her life. Other things you can do, make sure your workplace has a place for moms to pump. This is a law for any place of employment with over 50 employees. There has got to be a place for moms to pump. Mom should never have to go to a bathroom to breastfeed her baby. Would you want your lunch served there? And let expectant women know that they are eligible for a breast pump from their insurance company so they can return to work and still provide breast milk. Number 2, support breastfeeding. If you've never breastfed, you may not understand what a breastfeeding mom is experiencing because you haven't walked in her shoes. But you don't have to walk in someone's shoes to be a fierce ally. So if you know someone is breastfeeding, tell them how proud you are of the decision they made. Ask if they need anything. Send them a home-cooked meal or some lactation cookies. Raising a child takes a village, and so does breastfeeding. If you see a mom breastfeeding in public, smile and tell her what a great job she's doing. If you happen to be a grandparent who formula fed your kids, look at the evidence and commit to supporting breastfeeding, even if you don't know much about it, because it'll benefit 2 people that you love, both mom and baby. And if you're a dad that's uncomfortable about your significant other breastfeeding because it may show her breast, just know that there are lots of ways to breastfeed discreetly or pump milk to bottles. But again, just support mama. The evidence shows that this could improve her health and the health of your baby for the rest of their lives. And number 3 is normalize breastfeeding. Mass-produced formula has only been around for about 50 years. In that 50 years, we have seen a major increase in obesity, high blood pressure, and diabetes. Could the extra sodium and sugars that are added to formula have caused at least some of this? On the flip side, mothers have been breastfeeding since the beginning of our species. Breastfeeding is the normal way to feed a baby. Moms who are breastfeeding shouldn't have to miss out on life because they're doing the very best thing they can for their health and the health of their baby. Remember, in Maryland, a woman has the legal right to breastfeed in any public space where she is legally allowed to be. That includes Starbucks, the Sunday church service, Target, or the Metro, anywhere that her baby gets hungry. So to wrap up, I want to be clear that I never want to make someone feel guilty if they fed their baby's formula. In the era that I was born, formula was made by mixing pet milk and Karo syrup. Moms still smoked during pregnancy, and newborns were held in mom's arms in the front seat on the way home from the hospital. But as Maya Angelou says, when we know better, we have to do better. So I hope this presentation and the question and answer session to follow helps you to know better, and then we can do better. Thank you very much. The next slide, please. And so these are just some of the other resources that I used for this talk. Next slide, please. And this is just a little information about our childbirth classes here, including that free breastfeeding class. And the email at the bottom is the way that you register for any of the childbirth or breastfeeding classes here at MedStar Southern Maryland Hospital Center. And that is the end of my presentation. Do we have any questions?
Thank you for that presentation. I have one question that came in asking what is the best way to, well, I guess if you can't breastfeed, what are the other safe options?
So it would depend on why mom feels that she can't breastfeed. If she still wants to make milk, of course, pumping and putting milk in bottles is the best option. Um, Formulas have some risks that are not often talked about. And so, really, if there's any possible way that baby can get breast milk, that is the lowest risk for the baby.
So it says, the other part was that, she is unable to produce enough milk.
And so, even moms who don't produce 100% of the milk for their baby, if they can produce any at all, there are benefits in breast milk, whether it's an ounce or a gallon that she gives the baby a day. So even if you're mixing breast milk and formula together in order to make enough feedings for the baby, the benefits of breastfeeding are still there. So any possible amount of milk the baby can get is a plus.
Kathy?
I'd like to add too. So the most common reason that women can't make enough milk to support their baby is because there's not enough stimulation and milk removal in the first couple hours to the first couple days of a baby's life. So if we can get a mom to, if the baby doesn't latch right away, if we can get her using her hands to express milk out right away, or we get her pumping, even though she might not see that volume in the first couple days, because the volume isn't there, but in the beginning, the baby's tummy is like the size of a teeny tiny marble. So it doesn't take much to fill it up. But if the stimulation and the colostrum removal happens like around the clock, at least every 3 hours for the first couple of days, that tends to hardwire some things in mom's body that she's able to produce more as long as she continues to, once she's getting milk out, she needs to continue removing it on a regular basis. So, so there's things you can do to set yourself up for success in the beginning, but sometimes people are so exhausted from the birth and everything that's happened. Sometimes things didn't go the way they planned. They ended up with a C-section, whatever, and everybody's exhausted, or they were there 3 days, being induced, trying to have a baby. So everybody's exhausted. And then, you're a couple days into it, like, oh, wait a minute, I need to make milk. But we need to do, so starting early is the big thing, and doing lots of skin to skin with your baby. That also helps with your milk supply.
And then we have some questions in the chat. Do these benefits to mom and baby health also apply if a mom exclusively pumps?
Sparkle, do you want to get that?
Yes. So the answer to that is absolutely yes. Pumping is still doing all of the stimulation that causes the oxytocin to come out. That helps you make more milk. It makes you bond with the baby. So regardless of whether you are feeding at the breast or pumping, the benefits of breast milk are there for both of you.
Can you take vitamins and other supplements while breastfeeding? Oh, I missed a bunch of questions. Sorry.
I'll take that one.
Okay.
Sure, absolutely. So, moms should continue to take their prenatal vitamins, while they're breastfeeding. I do tell moms that if you run out of your prenatal vitamin and it's cheaper to get a women's multivitamin, like women's health general vitamin, that's perfectly fine to support breastfeeding too. But they should continue to take some type of vitamin. Now, as far as supplements goes, it just depends on what the supplement is. There are some herbal supplements that are beneficial for breastfeeding, and there are some that may not be recommended. So that would be something somebody could consult a lactation consultant about, and they could help navigate that.
Do certain foods make breast milk taste better?
I love this question. So everything you eat or drink does go through the breast milk to the baby. And babies can be kind of particular. Some babies love the taste of garlic. Some babies do fine with spicy foods and foods that would normally, years ago we had like a 2-page paper of foods we weren't supposed to eat when we were breastfeeding. But people in other cultures ate those foods all the time. We were just making it really hard on moms here to be successful at breastfeeding. And so, yes, you may find that your baby is kind of funny about the milk if you eat certain foods, may love other foods. Different foods can even change the color of your milk. So, all of that is fine. The cool thing about that to me is that you're going to end up with a less picky eater when the baby's older because they are learning the taste of the family. So, like whatever you normally eat with your family, they're learning that from the breast. And so, when you get them on solid food and you put that food in front of them that they've tasted so many times through the breast, they're going to not be picky about eating it. They're going to love it.
Are there certain, I'm sorry. Certain foods or drinks someone should avoid while breastfeeding?
Certain foods or drinks that should be avoided.
Hmm.
Um, Again, like I said, we used to have a long list of foods that need to be avoided, but we found that that's just not true. But every baby's different. And so if you eat something, let's say that fire sauce at Taco Bell, and then you breastfeed your baby 2 or 3 hours later, that's when that food is going to be present in the milk. So if you're eating really, really spicy food and the baby gets fussy or you notice a rash or something like that, the baby may be sensitive to that food. So think back to what you ate 2 to 3 hours ago. And as far as drinking, when you are breastfeeding, you have to drink a lot of fluids. That includes your waters. You can have juices. Anything with caffeine should be in moderation because it can make baby fussy if there's too much caffeine in mom's system. And a lot of people ask about alcohol because, of course, during their pregnancy, they were encouraged not to have alcohol at all. And it is still suggested that, if you can do without alcohol, that's perfectly fine. But they do say that after you, again, it shows up in the milk about 2 to 3 hours later. So if you had a glass of wine with dinner or, beer with crabs, because that's the only way they work, it is okay to still breastfeed your baby, but you would want to wait a couple hours from when you had that drink, 2 to 3 hours, so that it would be clearing your system before you fed the baby that milk.
The way I like to compare that one is to like driving. Like you wouldn't have a glass of wine and get right in the car and drive. So you might have your glass of wine at the restaurant at dinner, and then after you have dessert, an hour and a half, 2 hours later, it should have metabolized out of your system. So you want to let that alcohol metabolize out of your system.
Do you have any advice on preventing mastitis? Hopefully I pronounced that correct.
You want to do that, or do you want me to take it, Sparkle?
You can take it.
So one of my big things is what I call like really good nipple care. So, good nipple care with clean hands. And the thing is, we're all carrying around our phones. We're taking care of the baby. We got the phone in our hand. So I always tell people, so before you do your nipple care, make sure, you wash your hands really good and dry them really good. If you've changed a diaper, you've been on your phone, don't do that. And why is this? Well, so sometimes breastfeeding can make the skin around the nipples a little dry. If you get some cracks, or worse, if you've had some latching problems and the baby's caused a little trauma to the nipple, now you've got an open portal that can allow bacteria to get up into the breast. And the other thing is, one of the biggest causes of mastitis that I've seen is when moms end up, they go too long between feedings or between getting the milk out. They let things get a little overly full. You know, maybe they had a lot of company and they waited and waited and waited to put the baby. And this is after the milk is in. They get a little overfull. The baby doesn't empty it well. And then they end, you know, can lead to like a little blocked duct there, which can, you know, develop into an issue. And mastitis can happen pretty quickly. So I like to recommend like keeping the nipples, you know, clean, but not with soap. Like in the shower, you can just use water, but clean hands before you do your nipple care. Lanolin is what we use in the hospital. Lanolin to the nipples is kind of like chapstick is for our lips, where in the wintertime, it doesn't heal the lips, but it keeps them protected. So when you go outside, they don't get more chapped than they already are. The lanolin does the same thing. So good nipple care, regular milk removal, getting enough rest, you know, trying to sleep when the baby sleeps. And you know, don't head out to go for a 4-hour shopping trip without your baby or at least your pump, because then you're going to get overly full and then you're going to run into trouble eventually. Do you want to add anything to that, Sparkle?
I was just going to say, Kathy, because I think you and I have both noticed this too. When moms return to work,
Yes.
sometimes they put off pumping because they have one more meeting to finish or one more phone call to make or one more email to send. And you will pay for that. You know, when you go back to work, it's very time intensive in the beginning because you're going to have to pump as often as the baby's eating at home, which is probably for a mom that goes back to work at 12 weeks, the baby's probably still eating every 3 to 4 hours. And so, you know, mom is going to have to empty her breast several times during a regular workday. And if that doesn't happen, that can definitely set you up for issues with mastitis.
And I think some moms do really well with the new hands-free pumps, and I think that has probably made things a little easier if moms have access to that type of pump, if they find one that's efficient for them. But then you also have to make sure not only are your hands clean when you do nipple care, all your pump pieces, all those things, you know, need to be kept clean. So you're bringing them to the workplace and you need a safe place where you can do these things and be able to wash your hands and all of that.
We have a few comments from, I want to say Lowell. As a mom who breastfed 4 kids for 11 to 30 months, supply and demand is key and lots of water. Fenugreek also increases supply. After exercising, I noticed my milk is offensive, so I would pump and discard, and they did much better. I think it's one more, 1 second, 1 second. And I had to avoid dairy, eggs, because my child was allergic. I can't see this part. To continue breastfeeding. So
Some babies can develop sensitivities and they may be allergic in the beginning and it may be something they completely outgrow. And that's why Sparkle was saying, you know, notice, you know, if something happens a few hours after you've initially taken something in, but if it's a true, like a dairy allergy, a lot of times you'll see that in the diaper. You'll see a really fussy baby. And these are things a pediatrician and a lactation consultant can help you work through. But like Sparkle said before, every baby is so different and you just never know what's going to happen. But dairy is probably the most common allergy to have, and it's complicated because almost everything has dairy in it. The dairy and the soy, they're the hard ones and the common ones. But it can be done, and sometimes it's not even for the whole breastfeeding journey. Sometimes it's just the first 6 months that you have to avoid those foods. It just depends on the child.
why might a baby not latch?
Well, Kathy, you can jump in when you want, but there's a million reasons why babies decide not to latch. I mean, here in the hospital, the most common cause is just everybody is exhausted, including that new little person, because they have just been through, you know, the move of their life. So, a lot of times it's because babies are tired. Sometimes it can be an anatomical issue with the baby, with what people commonly refer to as tongue tie. Um, and Other times it can be a problem with mom's nipple. You know, some women have nipples that tend to be flat with the rest of their breast tissue. It's really hard for a new baby to find that target to latch on well. So that's why here and at most of the MedStar hospitals, I think we became baby friendly because lactation consultants can't be there 24/7 in the hospital, especially with new babies that are learning to latch. And so MedStar supports baby friendly, and their hospitals go through the designation, which requires that the nurses that work with moms and babies have to have 20 hours of breastfeeding training and some hands-on observation of how they help moms and babies by the lactation consultant, so that even when we're not here in the hospital, there is someone at any time of the day or night who can help a new mom get a baby latched. When babies get older, there's other reasons. You know, somebody mentioned their milk tasted foul to their baby, so they couldn't, you know, they probably wouldn't latch during that time. Babies go through nursing strikes where they just decide for a little while that they're not going to latch. But most of these things can be easily overcome.
And one, I just want to add to that, so one of the struggles we have in the first day or so of life is sometimes babies are just as sleepy as the mom. And they're sleepy and they're like, they're hungry. They know they're hungry, but they're more tired than they are hungry. And they want to sleep. So I have had lots of patients who I taught them how to hand express, and they were able to express milk out of the breast into a little cup or into a spoon, or we would draw it up in a syringe, and they fed their baby for a day and a half. And then all of a sudden the baby woke up and latched and started, nursing just fine. So, unfortunately, sometimes what happens is when they're sleepy like that, especially if there's medical conditions, say they're jaundice or they've already had too much weight loss and they're sleepy or not latching right or well, the answer for a lot of people is just give the baby a bottle of formula. And not all babies, but some babies, once they've had an artificial nipple in their mouth in the first couple days of life, will no longer latch onto the breast. And they know that they're smart little creatures. They know that the milk comes out of that bottle easy. They don't have to work for it. And that skinny nipple on that bottle, sometimes they like that tight suck. They don't want to open their mouth really wide like they need to for the breast. So if we can, get moms through that first day and a half where babies are really sleepy, maybe not latching well, and find alternative ways to feed the baby the breast milk without putting a bottle nipple or even a pacifier in their mouth, a lot of times these moms are very successful at their exclusive breastfeeding when they've had to do that.
For moms who choose to pump as well, do you have any advice on finding, I think this is flanges, okay, that correctly fit the breast?
I can answer. I see Sparkle's still muted. There is a way to measure, but really most pumps will come with like an average size and either a smaller size or bigger size. So I always have my patients start with the average size, because really in the first couple days, the topography of the nipple and the areola, the dark part around the areola, sometimes it changes in the first couple of days, especially as the milk on day 3 or day 4 is like starting to come in and the breast's getting fuller. So the flange size that they use on the first day might not be what they need later on. Every once in a while, I have a mom who needs 2 different size flanges. But a good rule of thumb is if it hurts, it's not the right size. If there's too much air in there, it's probably too big if there's not good suction. So that's something that, a lactation consultant can help with in the hospital setting. And after that, you can certainly see like a lactation consultant on the outside. They do make these little tools. It's like a little square with little holes in it where you can place it over the nipple and you put the little hole over it and you can measure it. and you can see. But here's the thing, not every pump manufacturer makes every size flange. You know, one manufacturer might have a 24 and a 27, the other one might have a 25 and a 30. So you need to find the one that's the closest fit, that's the most comfortable, where you'll get the most amount of milk out. But that's a, yeah, good question.
So, this comment, it says also some pediatricians aren't supportive in breastfeeding, so choose wisely. And then I got a question on that as to why wouldn't they be supportive? Also, how do you know when you need a lactation consultant?
So the reason, well, I see Sparkle's going to say something, but I think the reason people might feel that they're not supportive is because they don't have the knowledge. The pediatricians do not usually have like special training in breastfeeding in their medical school. So you know, so you'll find that some of the pediatricians that are really supportive, maybe if they're male, maybe their wife breastfed their kids, or maybe they're female and they breastfed themselves. So they have their own interest in it from their own personal experience, but they don't have specialized training. The ideal model is where you have a lactation consultant who will work with the pediatrician, especially if there's issues with the baby, you know, weight loss, or, you know, latch issues or tongue tie or things like that. And then how would you know when you need a lactation consultant? I recommend that everybody take a breastfeeding class, and, you know, know what your lactation resources are, you know, near you, and at minimum attend a support group, which is free. Attend a support group. And but if you're running into trouble, you know, the latching trouble, there's too much weight loss, you're, you know, still just having difficulties, you still feel like you need 6 arms to do it, and it's been 2 weeks, it's time, you know, I used to tell people, if it's day 5 and it's not starting to get better, whatever you were struggling with, it's time to reach out for some help. What do you think, Sparkle?
Yeah, absolutely. I always say the first 3 days of breastfeeding are I don't want to use the word miserable, but for a lot of people, that's what it is. Um, so once you're past those first 3 days, things usually start to get better on their own. And if they don't, then definitely talk to a lactation consultant. I don't know what other MedStar hospitals do, but I'm sure they have similar things as we do here. Every mother that delivers here goes home with a list of the breastfeeding clinics in the area, the private lactation consultants. And remember that WIC offices have breastfeeding specialists in every single location. So there is help out there for moms and people for them to see. We don't want moms to feel like we did when we were breastfeeding years ago, where we were basically on our own. And that's why I mentioned kind of struggling through my first breastfeeding experience. Moms are not on their own anymore. There are a lot of champions for breastfeeding out there in the community. And, you know, the pediatrician should be one of those advocates for breastfeeding. But exactly what Kathy said, I mean, even in my nursing program, we never talked about breastfeeding at all. So physicians unfortunately have to go through that same kind of thing. And, you know, maybe there is a different doctor in the practice that's a little more breastfeeding friendly, or you know, maybe again they can send you to somebody they know that's a lactation consultant. So you know, don't hold it against your pediatrician if they're not as comfortable about breastfeeding as Kathy and I are, because this is, you know, what we've been, this is our specialty. So, you know, be kind to your pediatricians, but also, you know, advocate for yourself. If you feel like something the pediatrician is saying maybe doesn't sit well with you, check it out with your friends or call a lactation consultant. There might be a way that you can work around whatever, not that I'm saying to ever go against medical advice, but there may be options that the pediatrician doesn't necessarily think of. So that's when you need a lactation professional.
When is a good time to start introducing solid foods?
So we just talked about your pediatrician, and they're going to guide you with that with that process. But the American Academy of Pediatrics recommends that babies are exclusively breastfed through the first 6 months, and that complementary foods like solids are added after the baby is 6 months old.
How long should you ideally breastfeed?
So the American Academy of Pediatrics, just like Sparkle was just saying, recommends exclusive breastfeeding for 6 months, adding the complementary foods after that, which means you continue to breastfeed, but while you're introducing, solid foods, and for a year or more, as long as mom and baby want. So there's no cutoff point, but 12 months would be the minimum. And normally you wouldn't stop cold turkey at 12 months. And sometimes the ceasing of the breastfeeding is mother-led and sometimes it's baby-led. Sometimes they're like, I got a sippy cup and I got Cheerios now. I'm good.
Do nipple shape and size affect breastfeeding?
The size only affects breastfeeding and how you hold the baby. I always like to tell the support person, or the father of the baby, men are really good with angles. And to me, like, it just, you would hold the baby differently if you had a small breast versus a big breast, and that's something we can help with in the hospital. There's lots of things we can do with positioning, and then help teach the dad how to help with, putting pillows and giving support and all those things. But the size of the breast has nothing to do with how much milk mom makes. You can have very tiny breasts and make perfectly adequate milk supply for your baby. Large breasts, really large breasts, can be more challenging because mom can't see where the nipple is. So it's a little harder for her to maneuver getting the baby on. And again, that's something we can help with, and we can teach family to help her with. And then as far as the nipple shape and size, that does affect. And I used to work with a lactation consultant, and I think this was just his experience, but he would say about 1 in 10 moms and babies are like a perfect match for a latch. The other 9 have a little learning curve they have to do. And, if the baby's mouth is small and mom's nipples are really big, or if mom's nipples are short, all those things can be challenges. And it's just a matter of letting the baby learn how to make it work, and teaching mom how to position the babies to make it easier for the baby.
Just another comment in the chat. This one's from Kate. Most insurances cover a breast pump free of charge and also offer free lactation classes. And then we have another question. Can breastfeeding help prevent food allergies through mother consuming foods?
Yes, yes. So they're actually recommending now that you, for instance, we all know that peanut allergies can be actually lethal for people. And they're recommending that, unless mom has an allergy to peanuts, of course, then she wouldn't, but that she eat peanuts through her pregnancy and while breastfeeding, because it very small amounts of the peanut protein actually go through the breast milk, because remember, anything you eat or drink will go through to the baby. So a little bit of it that's already been kind of broken down by mom's system is introduced to the baby. And often that first introduction is a mild way to help them get used to some of these foods that can be allergens. So absolutely. It also helps with respiratory allergies and asthma and things like that, because of the way it coats the gut. Um, it actually kind of fills in some holes along the baby's intestines, where allergens and the reaction to the allergens can start in the gut, even for things like hay fever and things like that. So Yes, allergies are greatly reduced by breastfeeding. Now, nothing's 100%, but at least you know that you're doing the best you can to help reduce any allergies, especially like if they run in families. Same thing with asthma. They find that breastfeeding actually decreases the risk of asthma in children more if their family has a history of asthma. So, breastfeeding, breast milk is just an amazing thing. It should be considered a medicine.
Can some moms be more prone to developing mastitis?
Absolutely. Just like everything else, everybody's different. Moms that tend to make large milk supplies sometimes are much more prone to mastitis than others. Stress is a cause of mastitis, and I can't think of a single new mother that I haven't met that's having a little bit of stress. So, yes, some people are just more prone to it than others, and they're the ones that have to be very careful, like Kathy said, about making sure those breasts are being emptied routinely. Um, Even things like long car trips, if your seatbelt is leaning against your breast for 4 hours and that breast is full, you're asking for problems. So, yes, some people do have repeat incidents of mastitis while they're breastfeeding, but I will tell you that in almost every case that I've read about or that I've dealt with personally, continued breastfeeding is the best prescription. You do need to see your OB to get antibiotics if you're having fever or signs of like flu-like symptoms, things like that. But continuing to breastfeed is really important, even if you are having mastitis.
Can you continue breastfeeding while pregnant with another child? Are there any complications that may arise?
Oh, go ahead, Kathy. Go ahead.
I was going to say absolutely, absolutely. Now the the taste of the breast milk at some point in the pregnancy supposedly changes a little bit. But it's and sometimes they don't, just like with the mom who said when she would exercise, her baby didn't like the taste of the milk. So that can happen, but some moms successfully breastfeed throughout her pregnancy. So once they've been already breastfeeding, like you would not start pumping in your pregnancy in the third trimester, especially if you were high risk or you needed to have a C-section, because pumping stretches the nipple, which causes oxytocin release, which causes the uterine contractions. And we don't want preterm contractions. We don't want contractions, unnecessarily. Hand expression does not do that, by the way. But for a baby that was already breastfeeding before the mom got pregnant and continues to breastfeed, it doesn't have the same effect, and it's perfectly safe. And I don't know if you want to piggyback on that, Sparkle, or not.
Yeah, so there is a lot of research out there right now about hand expression, even when you're pregnant, to prepare to bring milk to the hospital, whether this is your first baby or not. So in the past, there was a lot of fear of the preterm contractions that Kathy was talking about, but they are finding that hand expression does not cause the same effects with mom. So we have had plenty of moms in here who are waiting for their toddler to arrive, and they will breastfeed both babies. So yes, you absolutely can breastfeed while you're pregnant. You just need to make sure you let your doctor know that you're still breastfeeding, just so that they can keep an eye on you.
Because you're burning extra calories when you're breastfeeding. So,
Yep.
you need to accommodate for that if you're pregnant and you're breastfeeding. And then if you deliver a newborn and you have a toddler and you're breastfeeding both, that's called tandem nursing. And it's perfectly fine.
Do we have any other questions? That was the last question that was in the chat. No? All right. All right, so I want to thank our lactation and baby care experts, Kathy Gibson and Sparkle Lopez, for this valuable information. And we hope that all of you found this presentation very helpful. Always a big thank you to our MedStar team and our community partners for their collaboration on this initiative, and all of you for joining us. Check out the replays of tonight's session on the Facebook and YouTube pages. And we hope you'll join us again in 2 weeks, where we will ask the stroke expert. So thank you again for joining us, and enjoy your evening.
Thank you for having us.
Absolutely. Thank you. This was a great presentation. Thank you
Thank
so
you.
much.
Oh, thank you.
It was fun.